All right.
Okay. Hi, everybody. We're going to get started in just a minute. And while we're waiting for everybody to sign in, if you wouldn't mind just putting in the chat what state you're from, so I can have a little bit of an idea of who's online with me today. I'm from Indiana, and so some of the things I'll be talking about might be a little particular to Indiana, but I want to make sure to address, try and keep things general for nationwide. So yeah, so if you could just put that in the chat, that'd be great. Okay, hello, Virginia and Texas. Thank you. And Shannon, just let me know when we're good to go. If there's no one else in the waiting room.
No, I'm assuming there will be some stragglers because there always are.
Sure.
It's around lunchtime, but
Yeah.
it's also why we're recording it. So we can see you later. So
Okay. Well, we'll go ahead and get started. To respect people's time, and thank you for joining us. I think we have one more person, South Carolina. Hi, South Carolina, nice to see you. Thanks for joining us. I don't know if you're on a snow day like I am today, but thanks for taking time out of your day to join us to talk a little bit about finding a quality ABA provider. And going to talk a little bit from both the parent perspective and a health services administrator perspective about finding a quality provider. And so, what do I know? Why should you listen to me at all about this topic? Just want to give you a little bit of background on myself. I'm a health services administrator by training and profession. I've worked in healthcare basically since I was 8 years old with my dad's practice, but have been professionally in health administration for about 20 years and have broad experience in running physician offices, which are considered to be ambulatory care offices or outpatient offices, which is what ABA providers are as well, essentially in the medical field or healthcare field. And I also have a background in managed care contracting and health benefit design work. And because of that, when my daughter was diagnosed with autism and was denied coverage under her health insurance, I've spent the last 20 years advocating for health insurance coverage for people with autism. And Indiana was the first state in the nation to pass health insurance reform requiring coverage for autism. And my daughter was the test case, basically the test person to get that law enforced. So have been working on this issue for over 20 years now. And because of that, I've had 20 years of experience interacting with ABA providers of all types, large, small, for-profit, nonprofit, and I've seen the good, the bad, and the ugly. So I wanted to take that experience as a parent and as a health services management person and just, help make it a little bit easier on families to figure out how to drill down to what are some of the key components that an ABA provider really needs to have to be a quality ABA provider. And I am talking mostly from the medical or healthcare perspective, in many states, well, in all 50 states, there's health insurance coverage for autism in some way, shape, or form. So a lot of ABA is delivered via medical care or health insurance. But some of these principles are also very applicable if your ABA is delivered via the schools. Or via, I know in California, the system's very different with the regional health centers. And so some of these tips will be, very applicable to that as well. But I am speaking mainly from the healthcare and medical delivery of autism perspective. And so the bottom line is buyer beware. I think that it's important for families and caregivers to understand that ABA is a pretty young profession. It has grown very, very rapidly over the last 20 years, mainly driven by the increase in funding that came through being successful, parents being successful in advocating for health insurance coverage for autism. But that's made the industry and the profession grow very rapidly. And it's grown more rapidly than the guardrails on it have grown. And it's grown more rapidly than the regulations on it have grown. So you really have to be savvy and educated as a consumer, and to know your state and what kind of guardrails there are in your state or in your region for ABA providers or people who claim to provide applied behavior analysis therapy. Also, there's a lot of information on the internet about autism and ABA, and a lot of that information is not very good. So make sure that as you're investigating ABA therapy and investigating ABA therapy providers, that you get your information from reliable sources. And, social media is a great thing. Facebook's a great thing. It's a great way to connect with people, but it's not a good way to get information on science, on medical care, on healthcare, because it just doesn't have the oversight standards that are necessary to have really good, solid information coming from them. So I would highly recommend that you go elsewhere for your information about ABA and about autism treatment. And I'll talk about good sources as we go forward. And just also, a lot of times you have to follow the money and also follow the motivations of whoever's posting online or putting things up online. If they're trying to sell you something, or if they've never experienced ABA therapy personally, you just have to kind of take what they're posting online with a grain of salt. So some reliable sources of information about applied behavior analysis therapy. These ones that I have listed here are going to be good, solid, reliable places to get information. So their websites, their Facebook pages, their social media, they are going to be good resources for you. The Behavior Analyst Certification Board is the national body that certifies board certified behavior analysts, or the BCBAs, that are going to be overseeing writing the programs. So they have a consumer page. That is a good source of information. The Council of Autism Services Providers, or CASP, that's a national organization that is working right now to set clinical standards for ABA, to write out what the clinical standards of ABA are, what the standard of care for people who are receiving ABA therapy should be. And so they are a really good resource for good, solid consumer information as well, because they are made up of some of the best providers across the country, and they are really striving to improve the provision of ABA therapy across the country and really across the world. So they're a really good resource as well. The Association of Professional Behavior Analysts, APBA, that is a professional organization of people who practice behavior analysis in all types of settings, not just with people with autism. And they have excellent resources on position papers and things of that nature that, as a family member or consumer of ABA, you can look at those to get some idea of what the standards are for the profession. Accreditation is something that's just starting in ABA, and the Behavioral Health Center of Excellence is just one of a few accrediting bodies that are working on providing accreditation for ABA providers. And so that's some oversight, some voluntary oversight that can happen with an ABA provider. So whether it's BHCOE or it's another accrediting body, and I know that CASP is also working on accreditation, which is fantastic. It's great to have multiple organizations doing this. So there's some competition and there's some more eyes overseeing these programs. So that's a wonderful thing. So ask about accreditation and if it's being pursued, or take a look at what their standards are. So that will give you an idea of what a quality ABA provider should look like. Then ABA International is basically the kind of scientific oversight body for ABA. And they have some good consumer pieces on their website as well. One of my favorites is the Association for Science in Autism Treatment. And this is a great website because they give a lot of good information on ABA and on autism treatment in general, but from the perspective of what the good science is. There's a lot of, you've probably heard the term pseudoscience, and there's a lot of pseudoscience out there about autism. This website really helps to take out the pseudoscience, the fad treatments, the things that haven't really been evaluated thoroughly, and can give families a good sense of what are evidence-based treatments and what are treatments that have been shown to work for certain people with autism. So that's a good place to go. And then I always mention Kennedy Krieger. It's one of the most nationally known centers for treating autism. But really, you know, in our region, Cincinnati Children's Hospital is our regional leader in autism treatment. So if you have a children's hospital in your area that is really a regional leader in autism treatment, their website can also be very helpful, because again, they have the ethical obligation and the clinical obligation to make sure that the information they're putting out there is accurate, is the best knowledge they have at that time, and that it's been vetted. So these are the would be my suggestions for reliable information on ABA. So then evaluating a particular provider. You know, I hate to be a skeptic, but sometimes I'm a skeptic. And I think when you're picking something so important in your life, you do have to go in with a bit of a skeptical eye. And so one thing that you want to make sure to do is, like I said before, follow the money. Who owns the ABA provider does affect the quality of care. And my experience as a healthcare administrator in general bears this out. And the study of various fields of healthcare bears this out as well, whether you're talking about nursing homes or radiology practices or dental practices. The business structure of the organization does affect the quality of care. So that's why it's important to know who owns this ABA provider. It changes the incentives. It also changes the accountability. And it changes the way how much they invest in staffing, how much they invest in training. It also may, their business model may also drive some exclusionary criteria they may have for patients, or patients that they will not treat. For example, we have some for-profit and private equity owned ABA therapy centers in Indiana that will not see anyone over age 12 because it's harder to fight the insurance companies on that. And they're not likely to need a full 40-hour-a-week program unless they're quite severe. And they've decided business-wise, it's too much trouble. And so they have a hard cutoff of 12 years old. We have some ABA providers in our state who are for-profit that will not treat anyone with autism who has behavioral issues. Now that seems kind of a very weird thing to say if you're an autism provider, because a lot of people with autism have maladaptive behaviors. But what they're saying is we want to treat the kiddos that are high functioning, that are young, that are not going to put their their fist through a wall. It's less expensive and it's less challenging administratively. So that's their exclusionary criteria. And part of it is driven by their business model and what they want to invest in. So you do really need to take that into consideration. Margin and pricing. One of the benefits of being with a big ABA provider and having private equity firm own an ABA provider is they tend to have the money and time to have lobbyists and to have negotiators who could go in and negotiate with insurance companies. While that benefits the business, that may or may not translate into more money for actual treatment, because a for-profit organization and a private equity owned organization first has to pay back their investors and their profits go back to their owner. So that may or may not translate to better care or more funds for care. It may just translate to more funds for profit and to pay investors. So you just have to know that that might be a possibility going on if you are using a for-profit or a private equity owned ABA provider. And then there's ethical considerations. Healthcare is a business, but healthcare is a business unlike any other because it affects people's lives. If that you hear the saying, if you don't have your health, you don't have anything. And so having our health and having access to high quality healthcare is so important for our lives, for our ability to pursue happiness and fulfillment and work and school and all of those things. And so a medical or a healthcare business has to have different ethical considerations than a business that's making widgets or producing movies or making a product that isn't so ingrained in the quality of life of the individuals that they serve. So there's tension. There's tension in these ethical considerations and in these business wants and in the profit motive when it comes to healthcare, because basically the more money you spend on the patient, the less money you take home, the less money your investors take home, the less money goes into profit. So those are those ethical considerations there. And while individual clinicians, individual board certified behavior analysts have a full ethical code that they need to follow, we don't yet have an ethical code for the business owners of ABA therapy programs or an ethical code for private equity firms that own and run ABA therapy programs. So it really is kind of a buyer beware. You have to be careful that you know what you're buying and what you're getting into. So as I said, these are some of the common owners of ABA therapy programs. And I kind of listed them here from, at the top of the list is the ones that let's flip that around a little bit. At the top of the list is one of the entities that I personally get most concerned about because of the tension between the profit motive and the ethical considerations of the individual clinician. Because for example, if a clinician owns an ABA therapy program, their board certification, their license, if the state has licensure, that's on the line if the business is not following ethical guidelines, if the business is not providing quality of care. When you take the clinicians out of ownership of any healthcare entity, if you take the clinician out of management of any healthcare entity, then you run into the risk of some of those ethical considerations that are particular to healthcare providers being diminished or maybe not being taken as seriously. That's not to say that some will, certainly some will, but the incentives are different. And a lot of the incentives are to not take those things into consideration. So it's important to know. A family-owned ABA provider, that may sound wonderful, and it may be wonderful, but with all providers, the ownership has pros and cons. One of the pros of a family-owned ABA therapy center is they may be a family who has a child with autism, and so they get it. And that can be very attractive. But on the flip side, what happens if one of those family members is a clinician, the other family member is the business person, and there are some questionable business activities going on? Fudging some insurance, skirting the line on some insurance things, accountability. That can be a big issue and a big concern with a family-owned ABA therapy program. Where are the checks and balances? Where is the accountability? What happens if something goes wrong within the family? What's the succession plan? What's the business plan if the family relationships go sour? So just like any family business, there are concerns. And as a patient who is going to be affected by that, you kind of need to know what you're getting yourself into. Nonprofit organizations, on the positive side, they are worried about breaking even. They're worried about making money so they can invest in their future and invest in patient care and invest in growing their non-for-profit and all of that. So you are confident that with a non-for-profit, all the money is going toward keeping the organization high quality, keeping the organization going. But at the same time, a nonprofit's not going to have access to maybe the level of capital and the amount of money that a private equity firm would have. So again, pros and cons to each. And so you have to understand what those are and which ones you're comfortable with. I talked a little bit already about a non-clinician business owner of an ABA therapy center, maybe an individual who sees this as something that looks like it might be a good business to run, but do they understand the clinical piece of it? Do they understand the healthcare piece of it? Do they understand that the ethics of how a business is run in healthcare needs to be different than the ethics of how a business is run when you're making widgets or providing pizza or building cars? It's a different mindset. And do they have that mindset? And do they understand the ethical considerations of running a healthcare business? So those are all things to really keep in mind when looking at the ownership of the ABA therapy program that you may be utilizing. And I spent some time on it because I found in my experience that it is a big deal. It is a big influence on how the provider does perform and what they choose to spend their money on and who they choose to serve. So I think it is important to know. And if they don't tell you, ask. Feel absolutely comfortable to ask. You should feel comfortable to ask, and they should answer that honestly. It should be in their marketing materials if they're being transparent, but if it's not, don't be afraid to ask, because you have the right to know. You have the right to know who you're accessing. So the other big things that are important when looking at a quality ABA program, I've kind of distilled this down to the big three in my mind. It's the clinical team, that top clinical team. And then it's the training and the supervision of the frontline technicians, or RBTs. Sometimes they call them therapists. RBTs is a specific term from the Behavior Analyst Certification Board. It is a national registry of behavior technicians. They have a required training. They're required to take a test. So if an ABA provider is not using RBTs specifically, then you really have to ask how they're training their frontline people, because they're not necessarily going by the standards that the certification board has set up. So that's a big question to ask. And then the third thing is patient and family focus. Do they really look at that they're working with the entire family, if appropriate? If they're treating adults, it might be that they're only working with the adult. But if they're treating young children, if they're treating children who are living at home with their parents, or caregivers or guardians, is their focus truly on the best outcomes for that individual and their whole family? And do they gear their service to make sure that they accommodate the needs of the individuals and the families? Or do they create their service to basically do what is most convenient for them as the provider? And there's a big difference between those two things. Do they design their programs in a very individualized fashion? Or do they have kind of a cookie cutter template and they might tweak one or two things, but they just kind of put you in their box? Well, that's not what ABA is. ABA is a truly individualized treatment. So the treatment should be truly individualized. Every person should have a different program that is done through a process of assessment, writing a treatment plan, and discussing the proposed treatment plan with the caregivers so that everybody is on the same page. And so that also, and discussing the treatment plan with the individual when appropriate, so that their priorities and their goals are in that treatment plan, not just, this is the ABA we deliver, here you go, take it. The way that a good ABA program is developed is they talk to the individual, they assess the individual's needs and wants, they talk to the family, they assess the family's needs and wants, then they do the treatment plan and come back and circle around with you and say, you know, here's what we recommend. What do you think about this? So you want to make sure that that's happening. One thing I want to note, there are some things that I did not list in this big three, and that is slick marketing, social media presence, fancy facilities with pools and other things that kind of seem really cool and wonderful, and maybe really cool and wonderful. You know, certainly swimming is a great thing for our loved ones to learn, but that doesn't necessarily mean that the quality is good. If you're a slick marketer, or if you've got a really slick building, that's icing on the cake, that's fabulous, but that doesn't get to the core quality of the therapy that's being delivered. So while the facility should be clean, it should be medical clean, not just business office clean, it should be medical clean for sure. But having a fancy building or having a cool pool or a cool state-of-the-art playground in the backyard doesn't necessarily mean there's quality ABA going on there. They're bells and whistles and they're great, but it doesn't necessarily mean that there's good ABA going on there. So the number one thing is that clinical team. And so I want to talk about that a little bit. Credentials. What are their credentials? If you're with a large ABA provider, and especially an ABA provider that's for profit and is being run by a private equity firm, they should have, as part of the organization, PhDs in behavior analysis or psychology and BCBADs, people with doctorates. If they're that big, they should have PhDs on staff, not just some kind of advisory board that they talk to once a quarter, but who are actually on staff, supervising all of the clinicians, supervising all of the BCBAs, acting as mentors for them. Because as I said, ABA is individualized. Your loved one with autism, there is no one out there like them anywhere in the world. And that is the beautiful thing about our loved ones with autism. You've met one, you've met one. But that means that whoever your clinicians are, they have got to have a wide breadth of experience and a lot of depth of education and depth of experience as well. So if your top clinician is a BCBA who's been out of school for 3 years and is supervising 10 other BCBAs, that does not sound like high quality to me. That sounds like we're trying to get up and running fast. And so we're just putting the most experienced person who happens to be there in leadership. So you want to be careful of that. You want to check your state and see if they have licensure. If you do, you want to make sure that the folks who are working there are duly licensed. And you want to be, depending on your state, some states have licensure, some do not. I talked about also, you want to, if they don't have the RBT credential for their frontline people, then you got to do some digging about how they're doing the training of the frontline people. Are they training? I've heard horror stories of, a child goes to an ABA therapy center. They're with a brand new person who has never worked with kids with autism before. They had 2 days training and they're left alone with their child without supervision. That person doesn't know what they're doing. So you want to know what their training is. If they're not RBTs, what's their training and how many people fail it? If nobody fails it, then it's not that good of training. ABA is not for everybody, provider and patient included. So if they're not failing some people in their training program, you have to wonder if that's a really robust quality training program. Also, in certain states, you have to be careful about certain terms like autism consultant, behavior specialist, and this is especially true in states that don't have licensure for board certified behavior analysts or don't have any laws regulating ABA, because that could mean a lot of different things. It could mean that the person doesn't even have a master's degree in anything related to autism. It's kind of a catch-all term. And so it doesn't necessarily mean that this person even really understands what ABA is and claims to be providing it. So be careful of anyone who calls themselves these kind of nebulous terms and doesn't have board certification or doesn't have licensure if your state has licensure. So then these quality indicators that I was talking about with the top clinicians, like I said, PhDs that are part of the organization, not just contracted in another state or contracted in their advisors that maybe someone talks to once a quarter. It's great if the ABA therapy provider has an advisory board of clinicians, and they should if they're big enough. But that's not the same as having your top clinicians who are part of the organization at the PhD level. You also want to look at, if you're with an ABA provider and every single board certified behavior analyst went to the same online master's program, that is a bit of a red flag for a couple reasons. Different schools are going to have different schools of thought, and different schools are going to approach ABA a little bit differently. And there's a science to ABA, of course, but there's also an art to ABA. You have to be able to take those scientific ABA principles and apply them with a real person who's an individual and who you need to have some creativity when you're working with them. And so if everyone in the organization all went to the same program, there's not going to be a lot of variation in thought, and there may not be a lot of creativity in thought. Or, oh, we did it like this over here. Well, we did it like this over here. Let's talk about that and see which one works best for this person. It's not that that school's bad. It's just that they're not going to have as diverse of a staff and as diverse of that breadth of experience that I talked about if all of their clinicians come from the same exact school. So you'll want to look at that. Now, if their top clinician is a BCBA, that's not necessarily bad. Not every place has to have a PhD. Some ABA providers are not big enough to be able to do that. And PhDs don't grow on trees, so there is a supply issue there. So if their top clinician is a BCBA, that's not necessarily bad, but look at their years of experience. If they have 10, 12, 15 years of experience, that's someone who is much more qualified, most likely, to supervise other BCBAs than if you have someone who is fresh out of school or has been out of school for only a year, 2 or 3 years. I would say at least 5 to 7 years before they can be, a top clinician supervising other people. Ideally, PhD level, 10 years experience, 12 years experience, but we know there's a shortage of ABA therapy programs and providers across our country. So look for that, at least 5 years of experience. And the more years of experience, the better. And experience actually treating people. We do have insurance companies who are going out and training some of their staff in ABA and getting them board certified, but they have no clinical experience. So if you're a BCBA who worked for an insurance company for 4 years reviewing medical treatment plans, and then you decided to go out and become a clinician, that's kind of like having zero experience, because you've done a lot of paperwork and you've read a lot of treatment plans, but treating actual individuals face to face in the moment as they behave in the moment is very, very different. So you want to make sure to distinguish with that. And again, some red flags to look for. Lack of experience, a large organization with no PhDs as part of the organization, no advisory board, because basically you want to know, if you don't know what to do with my loved one, if you don't know how to treat them or treat this specific behavior or get them to acquire this specific skill, who do you go to for help? Who do you go to for mentoring? If there isn't anyone, that is not, that's a quality problem. So you want to make sure that you are looking at that. Then in terms of the BCBAs, like I said, they need to have a mentor. They need to have someone more experienced than they are to be able to go to for ideas and to go to for help when they don't know what to do. You also have to ask about caseloads. The caseloads need to be reasonable and manageable. Our public schools here in Indiana have kind of gone out and hired BCBAs, and then they're saying, well, we're providing ABA therapy. I would argue, no, you're providing consultants who can help teachers with certain ABA tools. But if you have one BCBA who is covering half of a school district with a caseload of maybe upwards of 100 children, that's not providing ABA therapy, because those caseloads from a clinical perspective are not reasonable or manageable from a clinical perspective. Also, you want to make sure that there is ample opportunity for eyes-on accessibility. Now, with the pandemic, here we are all on Zoom. A lot of things have gone to telehealth, and telehealth is a wonderful thing, but it has its limitations. If all of your child services from their supervising clinician are telehealth and none are face-to-face, whether pre-pandemic, during the pandemic, there should be some eyes-on opportunity that is safe and that is accessible, because behaviors can't be scheduled. And there's just some behaviors and some things that just can't be seen unless there's face-to-face interaction with the patient. So be careful if your ABA provider over relies on technology and over relies on telehealth to the point where it becomes a quality problem. And then again, with the frontline technicians, whether they're RBTs or not, you want to make sure that the organization has a system set up to make sure that those frontline technicians are getting consistent supervision from their board certified behavior analyst in person, through video, and consistently, not once a month, not every quarter, or I see this a lot. I hear this a lot from parents. Well, we were scheduled to have that supervision, but the BCBA got busy with somebody else, or they didn't show up, and we really haven't seen him or her in 6 weeks. That's a problem. So you want to make sure that they are getting that consistent supervision and making sure that they're getting that consistent mentoring from their board certified behavior analyst. The registered behavior technicians, or the frontline therapists, whatever the organization calls the frontline person, if they're not an RBT, then, like I said, you have to do a little bit of homework and see how their training and supervision compares to the RBT credential. And that to make sure that they are getting a solid amount of training before being allowed to work with a child by themselves without direct supervision, eyes on all the time. And then also rotation. Now, some parents think like, oh, I don't want my child changing staff over and over and over again. And with the pandemic, a lot of ABA providers have had to cut back a little bit on what some of their rotations are because they don't want to expose people together, want to limit that exposure. But do keep in mind that if your child only has one RBT or only one person that works with them, how do you know, and how does the board certified behavior analyst know if they are generalizing the skills that they're supposed to be learning? If your child will only do something for Jenny, but nobody else, well, that's great for Jenny, but that doesn't mean they've learned that skill. And so it is important. I love when I get a substitute RBT or when my daughter's therapy team rotates, because that's when I really get to see what she's really learned and what she's really capable of, because it's a new person. So don't be afraid of rotating staff. It does really give you a good idea of what your loved one can do independently. And it is an indication of quality that they make sure that generalization is a priority for each patient. The other thing to keep in mind is if they never rotate staff, fact of the matter is the data is much easier to fudge. If you have a staff of 2 or 3 or 4 people working with your child, and tech number 2 is always 100%, 100%, 100%, but tech number 4 is only getting your child to do this skill maybe 40% of the time, it might be that tech number 4 is not very effective, but it equally might be that tech number 2, who's getting 100%, is maybe fudging the data because that's easier. And so how is your board certified behavior analyst going to know which is which? So it has to all come down to training, supervision, and as many eyes on the data as can be safely with the pandemic to make sure that that is true and accurate data, and not just that's easy, you know, oh, I prompted it, but I'll say it was correct. You know, you want to make sure that what is happening is the truth. And that gets to what we call in ABA fidelity to the treatment plan. Also, if you have multiple staff working with your child, the BCBA has a much better way to see, a much better way to tell from the data and tell from how your child is behaving when they observe if the frontline behavior technicians are being true to the treatment plan and are following the protocols of what is supposed to be going on in the treatment plan. So that is a key quality indicator to keep in mind as well. One kind of horror story that I have heard from an ABA provider in our state is that they were allowing RBTs and frontline technicians to write treatment programs, and then the BCBA would just sign it. That is not what is supposed to happen. Certainly RBTs, since they're working with your child one-on-one, should give the BCBA input on changes in the treatment plan and what might be a good thing to put in the treatment plan or take out of their treatment plan. But they should not be writing those treatment plans and then the BCBA just signing them. RBTs or frontline technicians are not practitioners. They are not trained well enough in ABA to write treatment programs or to even draft treatment programs. So you'll want to make sure that that is not happening. And that typically happens in ABA therapy providers that have way too big caseloads for their BCBAs to keep up on each person. So be on the lookout for that as a red flag. This is an article, a link to an article that I wrote, and it is Indiana specific, but I will say that from a parent perspective and from my experience, I have a whole host of things in there about questions to ask. I have a tear out sheet that you could take with you or have on you when you're interviewing an ABA provider that can be helpful and just gives a lot more detail about kind of the good, the bad, the ugly, things that are good to look for, things that are red flags to look for. So if you'd like to access that from the Arc of Indiana's website and take a look at that. It will kind of put a lot more meat on the bones of what I talked about here today, because I did kind of go through things rather quickly, but I wanted to share that with you. So there is that. And then this is my contact information. So if you have questions or concerns, or if you have trouble downloading this article and you would like me to email it to you, please feel free to do that. And with the time we have left, if anyone has questions, I'm going to check the chat really quick and see see if there are any questions in here I can address. Let's see. What if there's a split? What if one part is nonprofit and the other part of the ABA is for profit? Yeah, that does happen. We have some, I've seen some ABA providers who they provide services both as healthcare providers and with contracts through the Department of Education, and one or the other might be for profit. And so you just, kind of have to look at whichever division you're in and just look for some of those red flags. Like I said, profit isn't necessarily a bad thing in healthcare or a bad thing in education, but it does change the incentives. And so it's all about the ownership and their way of doing business, and if they are truly committed to putting the patients first and doing what they need to do for a quality of care. So that investment in training, investment in supervision, investment in mentoring of their clinical staff are really keys there. One comment is that some ABA providers do clinic only, some do home, and some do community, and some do all three. And so, yes, that is also a big consideration in finding a quality ABA program that fits with your family's needs and your loved ones' needs. If you have a 20-year-old with autism, you don't necessarily want them stuck in a center all day long. You want to make sure that they are learning skills out in the community. So it really has to be individualized. And I really encourage parents to look, and caregivers to look for ABA providers who are committed to doing all three types of ABA: home, community, and center-based, because our kids need to have their worlds, our loved ones need to have their worlds expanded, not contracted. And so they need to be able to do their skills in every setting that they potentially could be in. So that is a very good point. And I do have in the article a lot more information about pros and cons to home and center-based, and things to look for between home and center-based as well. So thank you for that. Yes, behavior coach. That a behavior coach is not necessarily a board certified behavior analyst. So look for that as well. And then another question that we had here too, that is a really good question. Who is the client, the school or the child? As a parent and as a healthcare administrator, and also someone who's done a lot of IEP advocacy, I personally will always argue that the child, the individual with autism, is the primary client. Their needs need to be paramount. And there's a really good, and I will get this to Shannon to post for on the Autism Legal Resource Center website. There's a really good article about the ethics of being on a treatment team for a person with autism that involves clinicians, ABA providers, speech therapy, et cetera, and school personnel. And it talks about the ethical framework around which all of those professionals ought to work when they are working with an individual with autism. Because a lot of times what you see when there's kind of that triangle of the individual with autism, the school, and clinical team together, turf wars start to happen and egos start to happen. And that is not focusing on the individual with autism. That's the adults focusing on themselves and the providers focusing on themselves. So this article talks about how everyone needs to be focusing on the needs of the individual with autism and then delivering their services collaboratively together with that as the primary goal in mind. Many times BCBAs in schools work within other names but aren't working as a BCBA. Then the client in their world and the control many times comes from the school administrators. Yes, that is a big consideration when you do have kind of the mixing of the ABA and school. Like I said at the beginning of my talk, I was talking primarily about clinical ABA programs. And this does, when you get into a school-based ABA program, it does muddy the waters in a lot of ways and usually creates a lot of issues for the family and the individual with autism. For example, a friend of mine, his son's ABA is being provided in school by a BCBA that is contracted, and the BCBA was refusing to give him his child's medical records, saying, no, they belong to the school. Well, no, they belong to the parent and the patient. And, but because of that contractual relationship, there was some muddying of the waters, and the BCBA was adamant that he or she was not going to give this parent any records without permission of the school. And when it comes to medical records, you have your right to your medical records. So that was an issue. So that is something that is difficult to navigate. And that's why having that ethical framework is very important to have, and also having roles and responsibilities written out ahead of time before the work actually starts. Who's responsible for what? And who's responsible for record keeping and for what different things. In Indiana, it's a little bit more clear cut because we have educational goals are the purview of the school, medical goals are the purview of the medical system. There are two sets of records, and the parent and the child have, the rights to all of that. So it's still muddied, but there's a little bit more of clarity because most of our ABA in Indiana is delivered through the medical system and through Medicaid. Very few are strict, straight Department of Education contracts. Families that move every 2 to 3 years due to employment and military. Is there a website that families may visit to find a list of providers in that area? Many lists provided by insurance companies are out of date. Yes, that is a very good point. Insurance company network lists are notoriously inaccurate, and you cannot rely on them for good information. So you have to either call the individual provider and check to see what insurance they take. The other option is, depending on which state you're in, for example, in our state, our Indiana Resource Center for Autism has a list of ABA providers. Our clinicians who diagnose autism also try to keep lists of local ABA providers that they have vetted. Check in your state to see if you have a disability finder website. For example, in Indiana, we have a website called Disability Finder, and you can look for providers on there, but that may vary state to state in terms of what a good resource would be to find ABA therapy in your area that is also in your network as well. And then in terms of military families, the ECHO program, my understanding is that is very helpful. It's ECHO, acronym ECHO. I would suggest that any military families tap into that to look for support services as well. Let's see. I think it would be a good idea to make a questionnaire that parents could use to give providers. Parents could use these slides. Thank you. Yes, part of my article has, couldn't fit it into a 1-hour presentation, but part of my article has a whole slew of questions that parents could use to send to a provider to ask questions. And yeah, I think changing that into a questionnaire is a wonderful idea. And I'll be talking to Shannon about that. Perhaps that's something that we can do and put on the website.
Literally writing it down.
Yay!
Before you started saying it.
Sounds good. Yeah, it would be great to just have an easy printout questionnaire that people could just take, because why reinvent the wheel? You know, none of us have time for that. So, especially for autism parents. So, yeah, and it's just it's very difficult for families who do have to move for various circumstances in so many ways. Make sure to check when you're moving into a new state if the state has any particular assistance, especially for military families. I know in Indiana, we recently passed a law last year or the year before that if you are a military family and you move into Indiana, you will be given a priority slot on our Medicaid waiver lists so that you don't have to get on another wait list and wait a year or a year and a half or 2 years to get on our Medicaid waivers. They will actually assign a priority slot to your family. So if you are a military family and you are switching states, access the advocates in that state and ask if there are any state programs or legislation or whatnot that may help you get assistance more quickly and help you navigate things. Let's see. Yes, waiver wait lists are very, very difficult to live through. I believe that the ARC of Indiana was one of the organizations that advocated for the priority list for military families in Indiana. And we obviously had several legislators who were advocating for it as well, because they were made aware that this was a great need. And that's the other thing is our legislators don't know what they don't know. And I don't mean that in a bad way. If they don't hear from their constituents or from the community that something is a problem, then they're not going to address it. But if they do hear that this is a huge need for military families, and it has to unfortunately be done state by state because Medicaid is administered state by state by state. Let your legislators know this is a big deal for military families, and it's a great way that you can support your military families by giving them these priority slots, because it's not their fault that they have to move so often and their child ends up suffering. So, and if anyone wants more information on that Indiana legislation, email me. I didn't personally work on it, but I will find out what exactly who did and how they got it done. And I will let you know, so you can see if you want to try and do that in your state. Because 10 years it used to be like that in Indiana too. And it got better. So there is hope. It can get better. It really can. Any other questions on we have 1 whole minute left. Any other questions on finding a quality ABA provider, or really anything else you can think of? Well, I'm waiting to see if anybody puts in the chat. I will, Shannon, give a shameless plug for my next seminar with you all. Is going to be on service dogs and autism. And so if you just want to come for the cute dog, I totally understand. If you want to stay for the information, that would be great. But I will be talking about service dogs and autism and featuring Elf, the service dog who works for my daughter and is hilarious. So like I said, come for the cute dog, stay for the information if you want.
Yes, that's in April. And then actually Christy, who's in the chat, is giving our March webinar on TRICARE. So,
hey,
yeah, big group effort.
Teamwork makes the dream work.
Absolutely.
Well, thank you all for sharing an hour of your day with me. And I'm very happy that my daughter slept through this entire presentation. I was afraid she was going to be joining me because she has a snow day and so is here. So I was like, oh, well, we'll just let her sleep in and we'll get through this and then make her get out of bed. So thank you all so much. I appreciate it. And if you have any questions that you like, if you're like me and you think of all your questions at 2 a.m., shoot me an email. And if I don't know the answer, I will happily try to find it out for you. So thanks so much.
Thanks, Michelle.